Several children we have termed dullards. They are unintelligent, and they had repeated classes again and again. Over the years, we have come to realize that some of those children actually have what we call refractive error, meaning that they cannot see very far or they cannot see what is close to them, and they need a pair of glasses to be able to function normally. But because they are not detected, many destinies have thus been destroyed. Today we're going to be looking at a group of diseases we call refractive error. These are diseases in the eye that need glasses for somebody to be able to see very, very well. You're welcome to this edition of Sight Ed, a sight education program designed specifically to enlighten every one of us about eye health issues. Don't forget, we want to keep receiving your questions and comments through all our social media, and we will soon respond to some of them again as the time permits. Today, we have another specialist in the house. He's a consultant ophthalmologist. He's also a professor of ophthalmology, Professor Ernest Omoti. So I hand you over to him. Please listen attentively to this segment of the interview. Thank you very much.
My name is Afekide Ernest Omoti. I'm here to talk to you about a very common, one of the most common conditions affecting the eye that makes people seek from treatment from eye specialists or eye doctors. This condition is what we refer to as refractive errors. Normally, the eye is supposed to see objects or things that are far away clearly, and that happens because the rays of light that come from those objects focus on anybody's retina. Retina is a part of the eye inside that makes you to see what you are supposed to see. However, sometimes this light coming from anything you are seeing will not focus on that sensitive part of the eye called the retina. When that happens, what you are seeing becomes blurred, and that's what we refer to as refractive error. There are different types. The common ones which people talk about, one would be what they call myopia. Myopia simply means short-sightedness. What happens is that the people see objects or things that are very near them clearly, but things that are far, they do not see clearly. The other one is hypermetropia, or some people abbreviate it hyperopia. In that condition, some people refer to it as long-sightedness. In truth, it is not really long-sightedness, because people that have hypermetropia do not even see distant objects very clearly compared to people who are normal. Such normal people who see everything clearly are said to be emmetropic. So these hypermetropic patients need to make additional effort from their eye muscles, which we call accommodation, to see objects whether they are far or whether they are near. Those are the people that we refer to as hypermetropia. Then there's another condition which we call astigmatism. In that condition, the surfaces of the eye that bring what you are seeing, the image of what you are seeing, to a focus on the retina. That's what you are seeing, brings them so that the retina can see them clearly. The curvature is different in different meridians. So the front of the eye, the cornea, or the lens may be contributing to causing astigmatism. In that kind of condition, depending on the amount of that astigmatism, the child may be able to see fairly well or may not see well at all. But in all cases, the child is making so much effort to see clearly. So particularly when this astigmatism is mild. So they begin to complain of headache, tearing of your eye, bringing out tears, itching, and all sorts of things like that. For the sake of completion, I will just mention one additional problem, which is not necessarily by definition a refractive error, but It refers to conditions where people, because they are getting older, now require to use glasses to focus on near objects, particularly for reading. That condition is called presbyopia. It is due to loss of that accommodative effort with age, and it frequently starts anywhere from about 40, either plus or minus a few years and above. And you commonly see those people using glasses that have two segments or more. You see a small segment under for seeing near objects and far objects. They can either use the ordinary eyes or the correction for it. Now, this condition is particularly important because many of our children are born with some amount of refractive error, but the child has the ability to accommodate and compensate, but sometimes they are not able to compensate. And so you hear of children who go to school and they cannot see the blackboard well, or they are missing lines as they are writing and things like that. One big problem we have is that many parents will conclude that they don't want their child using glasses, but that is a very dangerous thing, because they think that when you wear the glass will make the eye worse. That is one group of people. But the truth is that you need to correct such refractive errors that are significant in children, because if you do not do that, it will cause further problems. The eye becomes lazy. We call that condition amblyopia. So that even after you've left the child to become an adult and you now say, okay, now you want to correct that refractive error, the child will never really be able to see very clearly again. So it is important that every young child, before they start school, are screened by an eye doctor, so that they will check to make sure that there is no problem with their refractive ability, so that they can be corrected quickly. Now, there are different ways by which we correct these errors. The common one is to use glasses, spectacles. They can be plastic, they can be glass. Some people may use contact lenses. These are lenses that small lenses that you wear in opposition to the eye. You wear it directly on the surface of the eyes, and nobody will know that you are wearing any lenses, because the contact lenses are on the surface of the eye, specifically on top of the cornea. There are even people now who don't have refractive errors, but they wear what they call cosmetic contact lenses. So it's something that's common. You see black people with blue eyes and gray eyes, is because they are wearing contact lenses that give them such colors. So they can be worn for cosmetic reasons as well as for these refractive errors. But there are surgeries, laser surgeries in particular, that can also be performed to reshape the surface of the eye and correct such refractive errors. Such surgeries are quite expensive because of the machines that are required to do them. So they are not readily available. But they are already available even in the country. But they are not commonly available. So the common ways to correct our errors will be the use of spectacles, which we call glasses, or use of contact lenses. So specifically, we need to correct these errors to prevent further problems as soon as possible. Let's even look at the social life of the child. A child that maybe cannot see far, and then you deprive the child of correction. What you have done is that the child's academic performance may even drop, because he doesn't see the board clearly and probably has to be copying from his mates all the time. And you will now think that there's something wrong with the child. Why is he copying? He should be seeing the blackboard by himself. And in classes, maybe the teachers will not be bringing them to the front, come and sit in front. And even then, they still keep struggling. It's better to allow your child to wear his correction so that he can participate fully in all activities, including sporting activities. In such cases, you expect the child to wear plastic lenses, so that when they are involved in any outdoor activities, they can see everything happening around them. I remember very clearly, there are even people who have become adults. They are short-sighted. They only see from here to maybe like 5 or 6 meters away clearly. Beyond that, they don't see well. And they get to adulthood, they're thinking that they're seeing very well. And they start driving cars, and they don't know that they can't even see anything beyond a short distance. It is very important that these presbyopic patients get their eyes properly tested before they take glasses. Now, these people are adults. So what some people do is that they just go to any place, collect any pair of glasses in a market and just test which one can they read with, or sometimes borrow somebody's own and check and see which one they read with, and they can read with it. That is wrong, because one, apart from the fact that you will get the wrong pair of glasses and then you will cause strain on your eyes, headache and other problems that will come through. It is important an eye specialist looks at your eye, because that age, about 40, is a critical age at which other diseases start to appear in the eye. Diseases that can get you blind. For example, glaucoma, the condition that is silent, a silent sneak thief of your sight, starts around that age. So by testing you for the glass at that time, they also check your eye to make sure you don't have glaucoma. Because glaucoma is something that will not tell you that is blinding you. Then one day you just wake up and discover that you are practically blind. Other conditions like people that have diabetes, sometimes they're even picked from examining the eye. Hypertension can be picked from examining the eye. And it's a set of other conditions. And they all tend to start at about that age. So it is very important that you have your eye tested by a specialist when you start having problems with reading, rather than just going to buy any spectacles you find anywhere else in the open market and things like that. It doesn't cost so much to see an eye specialist. It's also very important too that we dispel some things that people think. Apart from the fact that some people think that people are too small or too young to wear glasses, there is no age at which you are too young to wear glasses. Even a newborn baby can wear glasses. There's nothing about it. Everybody can wear glasses, as long as it makes you see clearer. In fact, there are conditions in the eye caused by refractive error, which can result in misalignment of your eyes, what people call squint, which some people call half past 4 eye or half past something eye, where the two eyes, and one eye is looking one way, the other eye is looking the other way. Some of them start in very early childhood, even before the child is 6 months. And you may discover that all the child needs to make the eye straight is just to wear the correct pair of spectacles, correct pair of glasses, and the eyes will be straight, rather than being burdened by having the unsightly appearance of that squint. Very important. It's important to know that there are things people spread about wearing glasses that discourage people from wearing glasses. They will tell you that your eyes are becoming bigger, smaller, or becoming deeper. All these things cannot be true. Wearing something in front of your eye cannot change the way your eye is. It is true that the lens you are wearing has power. Either it will increase the size of something when you look through it, or it decreases the size. That is the lens you use to correct the eye. The eye only appears that way when you look at the eye through that lens that he's wearing. When it takes the lens off, the eye returns back to where it was. So the eye remains the same thing. In fact, they might return him back, because the eye never changed in the first place. It is just the way it appears through the lens. And I know some people, because some people may wear their lenses continuously, they don't take it off. When they take it off, they suddenly look different. But all that do not mean anything, because the lens you are wearing outside cannot change the way your eye really is. The refractive error of the eye tends to change with age. Give an example. When the child is born and is much smaller, and the eye is small, the child has hypermetropia. This is what people call long-sightedness. But as he's growing older and the eye is getting bigger, that error starts to reduce. And eventually, the error might, depending on the amount of error that the child started with, that error might be eliminated and the child becomes ametropic. That's normal sight. Or it may even go beyond it and move from hypermetropia to myopia, depending on circumstances. And if the child was myopic at an early age, as the eye is getting bigger, the myopia will even get worse. So it's not the glasses that you are wearing that's so if you see a child, for example, who was wearing glasses at one time or the other, and the vision is getting worse and it needs higher and higher powers, it's not the glass that made his eye worse. It is the fact that the eye is growing, the error is increasing, and it requires higher power. Same thing with presbyopia. The person is reading with glasses today, maybe +1 today, tomorrow, and maybe in a few years' time, this guy is now +1.5, and then another 5 years, another +2. It's not because the glass is making his eyes bad. It is because with age, the amount of accommodation is getting less, and he requires a higher power to focus for near. That is the reason why. It is not because the glass caused any problem. Well, those who are using glass may want to argue one point with me, that when they've worn the glass for some time, they can no longer say what they were saying before. Yes, it's possible, because your eye is now relaxed. It will take a little time for the eye to start training itself to get back to where it was before. But it's only achieving that because it is training itself to achieve it. So the eye should be able to see things clearly with comfort, not with strain. So I advise everybody who has any problem with sight that requires spectacles or contact lenses to please get the appropriate correction for this refractive error, so as to avoid other problems that will arise and improve their quality of life. Because if you don't, you will be losing a lot. Or many of the things people say to discourage you from getting glasses, either for your children or for those who are adults, are not true. You can as well say that if you are slim, wear clothes that are very loose and you will go fat. Or if you are fat, wear clothes that are very tight, then you will go slimmer. Nothing will happen. The glass is outside your body, so it cannot change you. That is the truth. So people should feel free. Wear your glasses and make sure you meet a specialist to check your eye, because every eye doctor that checks your eye at the time you are getting your glasses also checks for other diseases peculiar to that age, and that may be what will prevent you from going blind. And sometimes they will detect a disease that could be life-threatening, and they prevent you from losing your life. If you have hypertension, you may never know. It may just be that doctor who examines your eye when he was giving you glasses that noted for the first time that there are hypertensive changes in your eye. Let's test your eye, test your blood pressure. Or there are changes that are due to diabetes. Let's test your blood sugar, and then they will discover that you have diabetes, and that is life-saving in itself. So please try to get your eye properly tested early enough and get the appropriate correction by an appropriately trained eye doctor. Thank you.
All right, viewers, I'm sure you've heard it all from Professor Ernest Omoti, talking on refractive error and how we can manage those conditions. I do hope most of our questions have been answered as it relates to glasses. Several times parents come and they say, no, this baby is too small to use glasses. That decision should only come from an eye care specialist, because we want the children to grow normally, and they need to have good eyesight to be able to develop and to function optimally. Thank you very much. So now we're going to go on to the segment of the drama clips, glaucoma, the silent thief of sight.
Baba still remain blind even after seeing doctor in town.
Have you?
What did the doctor say? The doctor said there's nothing anybody can do to make Baba see again. Not even the Oyinbo.
Sorry, Sorry. I will see you when I return.
Okay.
Baba, now welcome. Sorry. Take care, hello.
Brother, why is it that Papa is not seeing me again?
Jude, I don't know.
There are about 3 people that are blind in our village. Why?
Jude, I don't know. It's only the doctor who can tell us why people go blind.
I will make sure I become a doctor when I grow up and treat all the people that are blind in this our village.
Jude, that's very good. That's good. But you need to put this in your mind. You must read your books. Read your books well, okay? That's good of you.
Shit! What a mess! You, this man.
Sorry, sir, please. Yeah, sorry.
Are you blind?
TJ?
You must be out of your sense.
TJ?
I already have trafficked.
I did not see the punter now. Yeah? That's serious, oh. That's serious, oh. But it's as if you need to go for eye tests. If you can't see it, that means you have eye problem.
I don't have any problem with my sight. At least, I drove this car from Lagos to Ibadan yesterday. And the last week, I took my Oga to Calabar. What are you telling me?
TJ, let me get down.
Get down for what?
No, I'm okay. Let me get down, please. Let me get down. I said let me get down.
Why now?
It's okay, let me get down, TJ. It's okay. I am not going again. Back.
But you need to take it easy now.
TJ, back.
What are you trying
I
to
say back now. Park the car. Park. I'm not going again. Park.
Wait now.
TJ, park. I'm not going again.
What is this?
Plantain, ma.
Orange. Can't you see these things are rotting?
These are fresh, ma. They are fresh plantain.
Are you blind? Take from my hand. Go on, throw these rotten things into the dustbin. Nonsense. Come here. I hope you know that as you are throwing this thing into the dustbin, that is 2,000 naira out of your salary that you are throwing into the dustbin.
Is that you? Look at this story. Very funny one.
Which one?
So interesting. This one now, page 4.
I have changed glasses like 3 times in 2 years. This one, I changed just last 2 months. And yet, I can't read clearly with it.
Mr. Chuku, I advise you see an eye doctor.
You have glaucoma. And it is advanced glaucoma.
Why is the doctor not asking you to have a surgery?
Surgery?
Yes. Why?
Your pressure is very good. 10 and 12. Very, very beautiful. I remember very well. You just came in for checkup the other time when we noticed that you have glaucoma. And after we offered you surgery, everything has been fine. Thank you.
Thank you very much.
As usual, Baba, your pressure has always been within the normal range, between 10 and 20. Like we used to say, Baba, when people come early, on time, the patient will be happy, the doctor will be happy. I'm so happy for you.
I've told Bayo too to go and check his own eyes at Teure. So you shouldn't bother to come down, oh. So make sure everybody, you and your younger sister, don't be late tomorrow.
What about the couple I saw here the other time?
Oga, he don't blind though.
Blind?
They say they hospital. The doctor said sickness is irreversible from glaucoma.
Glaucoma?
So you know him, glaucoma.
Glaucoma is not a human being. It's not a person. It's a silent thief of sight that must be arrested early by going for regular eye tests. Why are you pressing your eyes?
Oga, nothing.
Do you have glaucoma?
No, Oga. Go for visa.
Go for an eye test.
Alright, sir.
Okay.
Thank you, sir.
Check your eyes before you become a victim of glaucoma. If you have done a test before, make it regular.
Is it glaucoma or glaucoma? Whatever. But I'm sure you do know that glaucoma is a disease that affects the nerves at the back of the eye and is usually due to a very high pressure in the eye. And this pressure needs to be controlled so that the optic nerve does not get damaged. That's why I'm going to be ending this episode. And we do hope you will join us next time on another edition of Sight Ed. Remember, Sight Ed is a sight educational program designed for you and I to educate us on eye health issues. I remain your host, Adepo Jufeyi, on Sight Ed, preserving vision, restoring sight. Stay blessed.